Hi, I'm Dr. Raghu Athre. I'm a double board certified facial plastic surgeon based here in Houston, Texas. Now, I get a lot of questions about fat transfer because that's kind of one of the procedures that's deep to my heart. So you've heard me kind of talk about all the pros of fat transfer. What are the cons of fat transfer? What are the risks of fat transfer? So let's go ahead and talk about those in this little short video. First of all, fat transfer is very different than volume transfer when you look at volume transfer from a hyaluronic acid type perspective. So patients frequently, when you get hyaluronic acid injections, so let's say you have a syringe of 1 cc of Restylane or Juvederm and you inject a cc in the face, there is a 1 cc noticeable difference in an area. Fat doesn't work the same way. So the fat itself, when you take 1 cc of Restylane and you take 1 cc of fat and you squeeze both out on a plastic table or plate, fat itself does not have a structural volume. So it's more diffuse, okay? Now that's a pro and that's a con. To me, I like that natural, softer feel. However, to patients that really like that uber super plump look that you can get with the hyaluronic acid, you can't get that with fat. It's not possible. So, you can keep pumping fat in and in and in. You're not gonna get that humongous fill. So for example, there are a lot of injectors out there that love to do this idea called the liquid lift, where they're using, multiple syringes of fillers to try and lift the tissues. And they can do that with the hyaluronic acid because of the fact that it has that structural volume presence. Now, whether that's good or bad, I'm not even getting into that thing. But if that's the look you're going for, that cannot be done with fat. It just looks too unnatural, and the fat itself does not have enough structural oomph, pushing power, and all of those things in order to achieve that result. So I think that's one major drawback for patients that are really looking for that. Where you really see this is in lip injection. More and more and more, you see patients that really want what I think hyper plump lips, okay? This is not a judgment, I'm not judging people, but this idea of beauty is a continual kind of spectrum. And recently there's been a lot of push towards these larger, more voluminous lips. That is easily done with hyaluronic acid, not so easily done with fat because it doesn't have that structural oomph pushing power. So if you're really looking for that kind of hyper full, overfilled type look, then you might want to consider staying with fillers. Another issue with fat is a downside to fat, which I'm seeing more and more, is that as patients are becoming super uber healthy, there's more GLP-1s like semaglutide and things out there. People are becoming very, very body conscious and things like that. You're having a lot of issues with trying to find fat, okay? So we have a lot of patients that are uber healthy that don't have a lot of excess fat reserves. So when we're trying to find fat, the places that I like to look, I like the abdomen, I like flanks, and I like thighs. These are areas that I think are easily accessible. Patients don't feel it very much when I do lipo in this area, and also the fat tends to hang out. Now, the problem with one of these areas, especially the thighs, in someone who, let's say is a 55-year-old patient, does not have a whole lot of skin contractility, and if they're super uber skinny and you do a little bit of liposuction in that inner thigh region, you can have a little bit of a contour abnormality in that region. In my opinion, it's pretty mild. However, some people may be hypersensitive to that. So these are some cons to fat transfer. And so when I talk to patients, when patients approach me for fat transfer, or I am using fat transfer as a component of my facial rejuvenation plan, these are some of the things we talk about as I'm discussing fat transfer in the pros and cons section when I'm consenting them for fat transfer. So I hope this video has been very useful. I hope you've learned something and you got something from this video. If you found this video useful and you want to hear more content like this, please give me a like or hit the subscribe button. It kind of gives us a little bit of feedback and kind of points us in the direction of where we're going to make future videos. If you have questions, concerns, or thoughts, please get a hold of us. You can call us, email us, DM us, and leave us a comment. We try and get to them as soon as we can. Till next time, I'm Dr. Raghu Athre, Athre Facial Plastics, Houston, Texas.